first. Now the recording has started. All right, so once again, a very good morning to all of you. I'm really happy that you could take the time, an hour of your time, to join us for this webinar today. So this webinar will be a bit special because we're going to be talking a bit more about our organization, Cancer Research Malaysia. So if you are interested in knowing how new cancer treatments are being developed, how do patient samples from research studies and clinical trials help make all of this research and progress possible? So for this webinar today, I have a colleague of mine, Dr. Joanna Lim, over here. She is the head of Cancer Research Malaysia's core lab or core laboratory unit. So she's going to share us what actually happens behind the scenes, from collecting and storing samples, most of them usually involve cancer, and how these resources actually fuel our life-saving discoveries. So Joanna, really great to have you here today. So a very good morning to you. How are we feeling?
Good morning. Thank you so much, everyone, for joining and listening a bit about what we do.
Yeah, perfect. So are you ready for the questions that I'm about to bring forth?
Yes, go right ahead.
Okay, perfect. So as it all goes, as it all starts out, could you tell us a bit about yourself as well as the work you do here in Cancer Research Malaysia?
Sure. So I'll just start off as I'm a Malaysian, went through the normal school system. I really was very interested in science, biology, particularly how the body works, but also, and the other coin, how does it break down? And I think I made it a mission for myself to be able to figure out, okay, what is it that people are, or what kind of diseases out there, and what can I do about it? And that led me to Cancer Research Malaysia, where we work on really the impact of Asian cancers and how better we can help every one of these cancer patients here.
That's perfect. Sounds like a very it sounds like a very fun thing, because even when I was a kid, I thought that, oh, science was just like a really fun subject. I think some of us may find it interesting, some of us may find it boring. I think it really depends on the individual, but I'm certain that maybe some of the attendees can definitely relate to you in terms of their interest in science, but whether or not you want to pursue a career in science, that's a completely different story, because it's not always easy, isn't it, Joanna?
Yes, that's right. I mean, there is a real sense of urgency to really figure out, how cancers are developing and what can we do about it. Cancer is one of the worst enemies, if you think about it. It has
Yes.
the ability to keep changing, and as much ammo as we try and hit it,
Yeah.
then it's just getting smarter and smarter. So we just need to put our brains together and be even smarter than that.
Yeah, definitely is a tough opponent, whether or not you are a cancer patient who is battling cancer, or whether you are a scientist in the lab just trying to figure out how to take down this disease once and for all. Because, cancer has been around for many, many years, I think maybe even in the dawn of civilization, who knows about it, right? But, recently we've only started to learn more and more about cancer. We're still learning more about it every single day. And honestly, yeah, it's really amazing that scientists like you are going out there trying to find better treatments and possibly find a cure for cancer in the future, hopefully in the future, the near future, right?
Yes, definitely. And I think we will, and we are discovering that already. And the good thing is that we're actually discovering it back home, right in Malaysia. So to actually help the communities and the patients right here.
Yeah.
And I think that's really, really important to kind of get across
Absolutely.
that.
Yeah,
Yeah.
absolutely. Yeah, it'll be really amazing if we can put Malaysia on the world map, like, oh, a team of Malaysian scientists have like discovered this sort of treatment for this type of cancer. That would actually be really revolutionary, and that would make us all really proud as Malaysians. Wouldn't you agree on that?
Yes, definitely. Yeah.
Definitely. All right. So I've already mentioned to the attendees that you are from the core laboratory unit or the core lab, we call it for short. So, what exactly is the role and the purpose of your unit?
Sure. So the core lab, you can think um, of us like an engine room. So we are behind all of the cancer research efforts. And one of our biggest responsibilities is looking after what we call a biobank. So this is
Right.
essentially like a bank where you would put money in and hopefully
Okay.
it'll grow into something really meaningful. For our bank, we are actually storing biological samples. So these are your blood, your cancer tissue, your urine, your stool, because for one day, we can actually find some answers as to why cancers are developing, but more importantly, how we are actually going to be able to do things like detecting cancer early or preventing cancers in certain groups, or how can we actually treat them a lot better. So that's essentially what the core lab does. You can think of as engine room, looking after
Like
biobank.
something like a bank. Yeah, you did mention about
Yeah.
a biobank, which
Yes,
I
that's
think you
correct.
explained a bit more in detail about what it is, because not many
Yeah.
people here know what exactly it does, how exactly it functions. But yeah, it is kind of like a storage system, and you're the ones who are handling all of these samples, correct? Something like that. Because I'm no
Yeah.
scientist myself, you're the expert here.
Yes,
Yeah.
and that's exactly right. So these are patient samples, and I think we have to really honor that just because
Yes.
these are patients that are actually going through their, probably one of the most difficult journeys of their life, yet contribute or take the time out to actually contribute either their samples or fill up some questionnaires so that they can actually help either future generations and others. So we are entrusted with this, and we have to make sure that we build systems to honor this contribution, and then to be able to make sure that these samples will actually lead to discoveries that will then be able to go back and impact clinical care as well as the patients that need them.
Yeah, absolutely. I can definitely understand where you're coming from. Yeah. So, we have a lot of departments here in Cancer Research Malaysia, and the core lab is one of them. But I'm actually curious, what exactly makes the core lab unique in the field of cancer research itself? Like, what makes it stand out as compared to other departments and other fields of research?
Yeah, so I guess, when someone thinks of a scientist, they always think of mad scientist,
Oh
just
yeah, something
discover.
like I don't know, something like
Yeah,
Rick and Morty. If you've watched it, I love it, but something like that.
yeah,
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 absolutely.
and yes, we do need them. We do need your discoverers really going out there and mining data.
Yeah.
Um, But I think there's a whole infrastructure of scientists, and Core Lab really sits in one of those areas where we do um, I guess, your routine groundwork and maintenance and quality checks to make sure that right from the get-go, we have very good preserved samples or and data that we can then hand off to the discoverers to go and okay, what are the certain biomarkers in it? What is going to differentiate one cancer from responding to a particular treatment and one cancer that isn't?
Yes.
So we're really kind of your framework,
Mhm.
your I don't wouldn't say we're bridesmaids or groomsmen. We are kind of your
I was
support
thinking,
team. Yeah.
I'm kind of like imagining a inventory. Am I correct? Like, say
Yes,
you're a
but
group of adventurers and you're the
very
ones who are
highly regular.
responsible with the supply, something like that, like the inventory. So if the somebody needs something, you're gonna have to like pull it out of the bag and give it to them. So something like that. Am I getting it right?
That's correct. But it's in a very regulated way because we have to remember that every sample comes from a person. So we
Hmm.
need to make sure that we the samples are being used for the research that's intended, and it's it's got to be scientifically sound and also very ethically regulated. So it just needs to be in a way, in a simple process, yes, we're a little bit like conveyor belt, but we also make sure that um, everything going through that conveyor belt is going to lead to something very meaningful at the end of
Yeah,
it.
definitely. Because it's not as something as simple as just keeping something and then just giving it to people. Because like you said, it's cancer cells, cancer tissues, and other biospecimens. So if
That's
anything goes
correct.
wrong with them, say that if they get contaminated, you obviously can't work with those samples anymore because they're dirty. You can't use it anymore. Otherwise, it will affect the results of the lab. So you have to keep it as cleaned and preserved as much as possible. So did I get that right?
Yeah, especially it has to reflect its original state. So one of
Yes.
the things about biological samples that are different from, for example, a can of baked beans is that it's very sensitive to temperature changes because there's a lot of different components in samples um, with very vital information, but it can only give us that information if it's preserved at really, really, really cold temperatures. And so we have built systems to, because just like in every other industry, there's going to be power outages. There's going to be things that, for example, driving to work today, you might have an important meeting and
Yes.
your
There's an
tire
accident on the highway and you are trapped in traffic
will
for
break
about like
down.
half an hour. Oh my
Yeah.
goodness, yeah. These
So that,
inconveniences that
yeah,
can happen
correct.
out of absolutely nowhere. Yeah, it's frustrating. Yeah.
Yeah, but that actually happens in a lab as well. So we've got really highly specialized freezers,
Yeah.
and we have power outages as well. And we've also got equipment, it's very similar to cars. And basically, a role of a core lab is to make sure we have systems and processes backups and backups for our backups to make sure that the samples are actually completely oblivious to anything that goes on in the external world. So if there's a power outage, we have something in place to make sure that the samples don't even realize there's a power outage. And that's our sole job and our sole responsibility. Same
Sounds
with the equipment, we make sure we have many spare tires if our
uh-huh,
equipment will
uh-huh.
start.
Yep, yep, yep.
Yeah, just
Yeah,
to make sure
definitely.
everything's running, just because samples are absolutely precious. There's no way of going back to that point of time and to that particular situation. So it's something that we hold, I think, very, very highly in terms of
Mhm.
ensuring the quality is maintained, and not just for the next 6 months. It's for the next, we're 25 years old, so maybe the next 25 years and even beyond.
Mm, okay. Yeah, sounds like a lot of hard work just to look after some samples, because you're basically treating it like your own children. You have to look after them, you have to make sure they're unaware of any dangers that happens in the world, and if something happens, you have to protect it. So it's kind of giving me
Yeah.
those vibes, you see what I mean? You have to be the parents and you have to look after a lot of them. It's not just one child, it's multiple samples. So I can imagine what sort of hectic thing that you have to play, what sort of role you have to play. Yeah, completely understand. Yeah.
Yeah. Well, the good thing
So
is they don't run away. They're not children. So
yeah,
I
they don't
think
they don't run
it's
away. Yeah.
fine.
For children, you
Yeah.
have to keep them there and they just run around the place, run around
Yeah.
the house, probably give you a heart attack if they disappear for 1 second. But these are like
Yeah, they're quiet.
really
Yeah.
these are really stationary children. They just stay there and they don't do
Yeah.
much unless you move them around yourself.
Yeah.
All right. So what would you consider the greatest achievement made by the core lab?
This is a really um it's got multiple levels. I think we have multiple achievements.
So you
First
can
of
tell me one of
all,
them.
yeah, sure. So maybe I'll start with the first stuff, going back to the sample itself.
Yes.
So we know every cancer prevention strategy, every cancer treatment breakthrough has come from a patient sample. And it's really it's almost cancer research is evolving as such that they're really putting kind of more patient-centric um, and more personalized situations. Because we do know that, you know, every sample is different, and we really need to kind of decipher that. And I think that achievement is to be able to decipher that for us, for our Malaysian samples. Secondly, also, I think I've in this industry, I've had really amazing mentors. Just reminding us that it's just more than the lab work, that we actually are helping people. And this is intrinsic to us, all cancer research actually, and I can say that as a testament to the whole organization, that being in a area where everyone intrinsically wants to help somebody, um, the way they have creatively innovated and put their brains together, and everyone's got a supercomputer, you know, between their ears, and to put all those great minds together and find solutions for cancer patients in Malaysia, I think that's probably the biggest achievement I think that Core Lab contributed to.
That's amazing. Really nice to hear about that. But okay, so since we are on the topic of achievements, I want to ask about the opposite. So, what is the biggest challenge that you and your team have to face? And for that challenge, how exactly did you overcome it?
Yeah. So this is really interesting, and you know, I wouldn't be a true Malaysian if I didn't really complain
Yeah,
about
what,
what's happening.
just say it.
Yeah, and really, it's not really complaining, but it's probably the reality that, you know, to try and build a lab infrastructure to meet international standards with very limited resources, I have to say that is challenging. But I
Mhm.
think the fact that the Core Laboratory Cancer Research Malaysia has really good partnerships across multiple groups throughout Malaysia. So these are your different healthcare departments, your doctors, your nurses, your
Mhm.
pathologists, your lab staff, the couriers, um, and of course the patients themselves, that I think we've been able to be creative in ensuring that we find solutions to address a lot of these. And despite having limited resources, we have never ever compromised on quality and scientific rigor. And so I think if you want to turn a challenge into really an achievement, I think that's amazing. And I'll put up, maybe might be good to just put an example. Some of the collection kits that we use to collect, for example, I know it's probably before lunch, but stool or, you know, some
Yeah,
blood samples usually come from
yeah,
Western countries, and you know, we know Malaysian ringgit is a little bit weak.
yeah,
So
exactly. Yeah.
we've actually, but what we've done, you know, in our side is to try and figure out, we've mined a lot of the publications. We found buffers, and we've actually made our own kit using materials that are available in Malaysia. And we've
Ah, I
actually brought
see.
the cost down. This really enables, first of all, be able to collect multiple time points, multiple samples, and still be within a lot of our grant budgets. So I think that's one example, but we do that, I guess, across. We're looking at more innovative ways to um, discover and
Mhm.
study cancers in a molecular level. And we're also doing it right across the cancer research pipeline.
I see.
I
Yeah.
hope I
I definitely understand where you're coming from because it's not a very well-known fact that cancer research itself, it's not usually done in Asian countries, like especially even here in Malaysia, because I'm sure that, for all of you who are attending here, when you hear any news about cancer research or any discoveries in cancer or whatnot, it's all always happening in the West, it's always the Matsale, the white people. But then have you ever stopped to consider that, where are the Asians in this? And the cold hard truth is that our DNA our race, our ethnic, it all kind of like plays a role in determining whether or not this sort of treatment is going to work on us. Is it, I think I'm getting the sort of like the background right over there, because whatever that the, the Guaylo, the Matsales, the white people discover, it may work better on them as compared to us. I think I've heard something like that. So you're the expert, Joanna. So just feel free to
Yeah.
correct me if I am
Yeah.
saying something incorrect, or if I'm, getting over there. I don't know, but that's what I've heard. So basically, we are very neglected in the areas of research. People can't be bothered about Asians. And ironically, Asia is like the largest continent here on Earth, and we have the world's, we have the most population here in the world. It's all in Asia, but, people don't really care about us. And that's why we are neglected. We are underrepresented in cancer research. So that's why we have like organizations like local organizations here, like Cancer Research Malaysia, who are sort of they are concentrating and focusing more on Malaysians, Asians like you and I. So I think that's basically the basis behind it. Yeah, unfortunately, yeah, some people just don't know about it. They talk about cancer markers. Cancer markers, I think those, most of them come from Western countries anyways, right, Joanna? I think.
Um,
I've
yeah, I guess.
personally never had it.
Yeah, I think the term we tend to use is Asians are underrepresented, and that's
Yeah.
throughout research, throughout multiple i- industries, including cancer. And I
Yeah.
guess if you think about it, if a lot of discoveries and breakthroughs out there, the new treatments, the new, I guess, strategies, they tend to be on a data set that is unfortunately um, mostly the Western countries, or at least the higher income nations. There are also Asians in there, but Malaysians particularly, and your Southeast Asians are really a minority in a lot of those data sets. And we do know that cancers actually on different ethnic backgrounds and different genetic backgrounds actually behave differently. They present a little
Yes.
bit differently. And I think it's really imperative that we kind of balance out that playing field, because you can imagine you get a lot more discoveries that may benefit non-Malaysians more
Okay.
so, just because they have the data set there. What we're
I
trying
see.
to do is really do the catch up and go, hey, have a look at our data set as well.
Mhm.
Let's see whether or not the same this breakthroughs, or even our own breakthroughs, are going to make sure that it works better for us. And how are we going to go about doing that? Yeah, and I
So
think it's a historic thing, just because a lot of the technologies as well, they tend to be a lot more developed in higher nation countries. So
mhm.
we're trying to partner with a lot of and vendors play a really big role here, and technology companies to try and see how we can get that for us as well, and for our samples.
Yeah, definitely. Because again, as we've already mentioned earlier in the conversation, we also want Malaysia to be on the world map so that people would actually recognize Malaysia as having achieved something in particular, something really groundbreaking or something like that. So that's why we are sort of like, focusing on Asians and Malaysians in specific, because well, when everyone in this world can get affected by a disease like cancer, I think we shouldn't be left out in the fight against it as well. It's so that everyone has an equal chance to actually fight against cancer. That's actually what I meant.
That's right. That's right. Yeah.
Yeah,
Agree.
perfect.
Agree to them.
Yeah. So is there something which you particularly enjoy doing in your work, especially in the core lab? Like, is there something fun that you usually do? I have no idea what exactly you guys do. Maybe you find joy in collecting samples. Maybe you find joy in the data sets and all of that. What exactly that you like the most personally?
Um, I guess I'll go back to the fact that our job and our day-to-day job has a lot of impact and meaning towards it. So, every time and our discoverers here have found certain biomarkers in cancers and then brought it into a clinical trial so that it actually impacts patients and actually improves, cancer treatment for patients. I think that's really real world impact that we are absolutely, I guess, proud of and very, very motivated by. So it's almost like every day we come to work, it's what can I do today to make sure that I help someone? And in this someone is I help a cancer patient, I help find answers for people, or I help, just getting a tool in a way to see whether or not we can figure out what is someone's risk of developing cancer and what are the strategies we can do around reducing that risk. So the fact that I played a part in that, I think is really rewarding and something that I enjoy the most. Yeah.
Yes, hopefully, we have people like you you enjoy doing the work that you do. You find that there is meaning to it, and if you manage to achieve this thing, it would actually help others. So I would actually say that it's a noble deed. It's really amazing that people like you are here helping others out, especially with a disease like cancer. It's a very serious thing, it's a very scary thing. And yeah, so it's quite reassuring to know that there are, there's people like you who are willing to actually go out of their way to lend a hand to these people in it, even though you may not be there directly for them. But I think the work that you do and the impact it creates can actually create a better future for cancer patients. And of course, not necessarily cancer patients, but for everyone who has touch wood, who has yet to actually come in contact with cancer, because prevention is always the better cure, you know? Yeah, so we want to prevent people from getting cancer
Yeah,
as
yeah.
well. We want them to be aware so that, they can take the necessary steps to avoid, getting the disease. And also, they know what exactly to do if they do come in contact with the disease. So they don't just sit there feeling afraid, unsure of what to do next, so that they can instead take action for their health and also their decisions.
Yeah, and I'm not unique. I mean, I speak for a whole group of cancer researchers that have an obligation really to use our skills to help advance cancer research efforts. And you're right, it's almost there's going to be, strengthening. We work together with a lot of health systems to strengthen that, propose strategies, evidence-based strategies. But what you mentioned is actually more on empowering individuals on how they can at least be informed, but also be able to take steps in,
Yeah.
either reducing a risk or, yeah, definitely finding answers that they're seeking for. Yeah.
Yeah, perfect. But do you actually spend a lot of time in the lab, Joanna? Like, do you usually like stay there? Because people usually assume that, oh, you're a scientist. Does that mean you always spend like 24 hours, 7 in the lab, just like tinkering around with your scientific equipment and whatnot? Is that true or is that not true?
Um, For me personally, to be honest, I don't. I do spend a lot more time now on the computer,
Oh,
um,
right. Yeah.
a lot of reading. So really, I mean, we are professional learners. We need to be really abreast with all the different technologies. We are constantly finding better ways of, preserving samples, processing samples. How do we improve systems? How do we um, literally foolproof a system that is already foolproof? We kind of need to keep pushing boundaries, and because of that, yeah, we're constantly out there just reading a lot, talking to a lot of people, working with different groups, trying to find also try to figure out what are the challenges currently that either cancer patients face, healthcare workers, health systems, and then be able to try and be part of that solution.
That's
So
very nice. Yeah.
less lab work for
After
me,
all,
but my
I
team
mean,
still
after
is
all, I
in
can
the
see you're in a lab right now. Maybe you're just there just to show
lab.
people, oh, hey, this is the sort of environment that we do work in. I mean, again, like you said, usually spend more time in a computer, but you do have well, lab experience. You definitely do.
Yes, and actually I do come in time to time, and I think um it's you can't take the lab out of a scientist. I
Yeah,
do
definitely not.
yeah, I definitely do the quality checks. I do just really check that everything is maintained well. It's, if there's anything that I can then improve on, I do the
Mhm.
rounds and just double checking the doors are closed and yeah.
Oh, yeah. Because again, you are handling
Yeah.
very precious specimens and you don't want anything to happen to them. Even though you have backups and you have the backups to the backups, it's like, wow, how
Yeah.
many backups do you actually have over there, Joanna?
Yeah, I mean, we do our own simulated drills of, what happens if there is
I
a power
see.
outage. How long does it take but these are very robust scientific freezes. How long does it take to actually then reduce in temperature by each degree, and how long it takes for us to get here, and then put up, our backup processes of getting, for example, dry ice and all sorts, and how do we then move things around. So I think, but this is our own kind of simulator drills, very similar to, people doing fire drills. We do the
Yeah,
exact same
wow.
thing in the labs.
Yeah, wow. So
Yeah,
you
and we
have your
test,
own lab drill so that in case of an
yeah,
emergency, all of you would have to like immediately rush
yeah,
into action. Oh wow, that
yes,
sounds really cool
yeah,
actually. Sort of like yeah, like you said, fire drill, so that people know that you have to like get up, get out and leave your belongings behind. But I'm sure this lab drill of yours is completely different from that. But I'm getting
yeah,
the same vibes from it.
yes,
Okay,
yeah,
sounds very interesting. Yeah, it's good to be prepared and know what exactly you have to do because again, if a real emergency happens, we don't want anything bad to happen. You know, the worst case scenario is that you lose your samples and that's basically the end of it. We can't work with anything anymore, can we? Without all these samples.
that's correct. We work in an environment that there's no room for error, and there is we aren't able to go back to it. It's not something that we can, if your fridge at home spoils when you go on holiday, maybe you can go back to the store and get another,
Some milk, some
groceries,
eggs.
yeah, milk.
Yeah, yeah, yeah,
Um,
yeah.
we know in our line of work that we cannot do that.
Absolutely
And
not.
that
Absolutely.
there is a lot riding on those samples to make sure that we utilize it to the that will actually result in discoveries. And sometimes that takes a while just because we need to collect enough samples to sometimes find really rare events, or sometimes just to have some statistical power to be able to make meaningful deductions and discoveries.
Yeah, definitely understand where you're coming from. Yeah. So, Joanna, I would like to also know what are your hopes for the core lab in the future?
Yeah, I have several hopes. The first is that we continue to work with multiple groups throughout and multiple industries throughout Malaysia, strengthening the core lab, um, be able to be a regional leader,
Yeah.
particularly for cancer research, expanding things like our technologies, our capabilities, so that we can really go down to understanding the biology of every single cancer cell and why it developed the way it did, and how can we really target it and eliminate it as best as we can? How can we harness things like our own bodies to be able to fight cancer selectively and, um, with less side effects? I mean, this is the hope that myself in a core lab, as well as any other core lab um, stuff out there, would hope for. And the second thing is that we continue to be worthy stewards of the samples that has been entrusted to us. So there's a lot of hope in the samples that were donated to us, and we need to make sure that we continue that, at least have a really lasting impact of that hope, so that it actually leads to discoveries that will come back to our own patients, our own communities, and basically our future.
Yeah. Because I think because when you obtain those samples, you get the cancer patient to consent, and then of course I think you have to surgically remove the sample from them. I think there's a lot of trust that goes on between the patient and also the scientists. And I think most of the patients are not even here with us today, unfortunately. So I think, yeah, it's definitely very crucial to maintain that trust, and also to sort of harness that trust to become a hope for future cancer patients. So
Yes,
that's the sort of
definitely.
idea that I'm having. Yeah, definitely. So it's not just about doing scientific work. It's not just about going to the lab, taking your samples, getting your equipment, running some tests, and then from your tests you get results. It's definitely more than that. I think this actually puts a more humane perspective towards the scientific field, especially in research, because people don't usually seem to notice it. They don't usually think about it or understand it. And they think it's just, like that. It's just like ABC and that's it. There's nothing else that goes into scientific research. But again, they are missing out on the more human side of scientific research. And I think, yes, hopefully by now our attendees have a better understanding of what exactly goes on. It's beyond science. It's just human. If I would to put it in one word, it's just human, just like that.
Yeah, it's definitely a responsibility that we have to everyone who has donated their sample to us, and to make sure that hope
Yes.
transcends even us and our organization. So I think, yeah, it's something that we take very seriously, and also um, we know that there's a huge sense of urgency to make sure that we're doing the work now. So, and actually doing the work yesterday. I think this is a motto that a lot of cancer researchers have, that we're making sure that we're building strides towards those, really preventing more cancers, really treating more cancers, and really saving lives. Actually, I think that that's the responsibility that every one of us, core lab, non-core lab, but every one of us cancer researcher holds to the core. Yeah.
Okay, and that's a beautiful answer. And now moving on to the final question that I have for you today, Joanna. So why do you think it is important for research on cancer to be conducted in the first place?
Yeah, so cancer doesn't discriminate. It
Yep.
really affects everyone from all walks of life. It doesn't matter where you live, what you're doing, and basically, we mentioned a little bit about how a lot of the breakthroughs and a lot of the things that can actually help cancer patients is done in the West, but we do know, because it's happening in Asians, it's actually different. And there's really a huge emphasis on to try and figure out, really right now, how we can alleviate that. How can we really reduce the number of cancers being uh, uh, occurring in the first place, how can we really treat them a lot more effectively to the point that the hope really for all of us is that it doesn't matter who you are or where you live. And if you do get cancer, it wouldn't dictate how you're going to battle it. And I think that is basically the reason why cancer research needs to be conducted right
Yeah.
here.
Yeah.
Because as much as we try to say we are no different, we are. We do know that there are different disparities depending on where cancer is being treated. And we want to make it a really nice level playing field in a very near future that really will be able to tackle every single Asian cancer that comes out. And
Mhm.
just because we know what we've learned from cancer research. So it really needs to be done right now. There's no
Yeah,
waiting.
definitely,
And it's an
definitely.
ongoing thing that needs to be done. Yeah. Asian cancer research. Yeah.
Yeah, definitely. That's a whole sense of urgency and responsibility that you all have to shoulder. Well, it is yours to bear. And yeah, what you said about how cancer doesn't discriminate really resonates strongly with me. I mean, it doesn't care whether or not you are rich or poor. It doesn't care, you know, what age you are or who you are in this world. It's just that it's a disease. It can't tell the difference, you know, as long as you have a body and it has something to invade, that's good enough for the cancer cells, right? So yeah, definitely. There's still, unfortunately, a lot of disparities that's still going on in this world. Earlier, you mentioned something about high income countries, and I'm aware that there's a disparity of cancer diagnosis and cancer treatment, you know, between the high income countries and also the low income countries, because, you know, we all can more or less guess which is the country that will have a higher mortality rate of cancer, like who is more unlikely to survive cancer as compared to another one. So obviously that's very unfair. So what do you mean that, you know, just because I was like born here, I earn this much, or I live in this place, it reduces my chance of getting treated for cancer? That's absurd if you ask me. So no one should ever have to go through a situation just like that. So that's why, again, it's only, I mean, we can definitely improve the system. We can definitely help these people, make treatment more accessible, regardless of your social standing or your financial situations. And all of this is only possible if we conduct research. Definitely. I mean,
That's correct. Yeah. That's
advocating
correct.
for it, saying for it is one thing, but you have to work for it. That's just how the world is. If you want a change, you're gonna have to work from it. And of course, with regards to cancer, a lot of the work needs to be done through scientific research. I don't think there is any other way through it, because you're dealing with sort of biology. So all of it just ties back to the lab. And of course, like, you know, you've mentioned a lot about the core lab and such. It all plays a different role in trying to ensure that one specific goal we want to achieve in hopefully the near future. Yeah, definitely. So
Yeah.
hopefully
Well
I've got
said,
all of
Amanda.
that
Yeah.
right.
Okay.
I hope I've got that all right. So again, yeah, if I said
Yeah.
something, just always feel free to correct me. Because I am no scientist, but you are the expert here, Joanna. So yeah, I really do
Yeah.
commend you, and as well as the rest of your team. I know they're not there with you, but I want them to feel equally as appreciated and acknowledged as well. It's really a commendable thing that you are putting your life, your time, and your energy into working towards that one common goal that you all share, and that is just to, you know, help us win the fight against cancer. Of course, it's easier said than done. It may not even be, we may not even be able to achieve it while we are still alive. We don't know for sure, but we are making steps, you know, step by step. We can actually get closer to the goal that we have in mind.
Yeah, I mean, we don't work in silos, and I think the only way probably forward is that we build the building blocks to get us a lot closer to that
Yeah, definitely.
dream of making sure that we basically outsmart cancer as much as we can. So we're putting our brains all together. We are leveraging on existing and new technologies as much as we can to
Mhm.
just get us steps closer towards, yeah, basically outsmarting cancer as much as we can.
Yeah, of course, we have to outsmart it, and I think we also have to remain optimistic about it. Like, regardless of whatever happens, you need to have a positive outlook, because negativity is never really a good thing in the first place. So yeah, I think definitely a lot of it ties back to optimism. You have to be determined, you have to be passionate, and of course, optimistic. You want to believe that you can actually have a brighter future for the cancer patients.
Yeah, yeah. I mean, that could be another talk altogether.
Yeah, that's
Because,
definitely, yeah, that's
yeah.
completely different. Absolutely. Yeah, but that's essentially all of the questions that I have for you. So
Great.
now I shall bring it to our fellow attendees right over here. So if
Yeah.
any one of you has a question for Dr. Joanna or me, you are free to throw in your questions right now in the chat or in the Q&A box. Oh, I actually do see one. Okay, so it's from an anonymous. I think it's for you, Joanna. So they asked, what
Yeah.
sort of data analysis does the core lab perform on a sample once it comes in?
Yeah. This is a good question. So in terms of data, uh, it goes back down to preserving the different qualities of the sample itself. So for us, we do know things like very rare DNAs in blood, for example, can be a lot more sensitive to temperature fluctuations. So a lot of the validation tests that we do is to make sure, how long can this sample be kind of shipped to us and how long it needs to be processed and the different components isolated so that it can be put at, minus 80 degrees or minus 196, depending on what the component is, so that it preserves the integrity of it. And we have little, I guess, I wouldn't say little machines, but machines to give us some inkling of the quality of those things. So if it's DNA, for example, we have a way of detecting how much DNA is in there. Also, whether it's still remains as a double-stranded, it's intact, or whether or not there might have been degradation. What is that level of degradation? And in the downstream technologies, for example, you would have heard things like sequencing, trying to figure out what the DNA letters are. They have some quality measures that they can kind of figure out, okay, they need a certain amount of DNA amount and quality to be able to give good data down the line. I hope that answers your question when it
Yeah,
comes to
hopefully.
the samples point of view.
Yeah. Perfect. I think that is the only question we have. It seems that everybody else is quite clear on what exactly the core lab does. I think they have no other questions. Am I correct? So last call for any questions before we
Oh,
proceed. Oh, there is another one. Oh, so again from Anonymous, are there any internship or volunteer opportunities available for an A-level student completing this year to gain experience in terms of lab work? So, Joanna, do you have any
yeah.
things about that? Yeah.
You're in luck because I'm actually also part of the internship committee. So we play a really
Ah,
big
that's
emphasis,
perfect.
yeah, on growing the next level of scientists as well in Malaysia. So we do have, when it comes to, we have both an internship program that takes in students 4 times a year. We do try and prioritize students, undergraduate students that do need them to graduate, because sometimes lab work or industry experience is required for that. But we also have a separate volunteering entry. And yes, I would recommend that you go to our website and apply for this volunteering opportunity. Um, we will have some areas where you may be able to shadow a little bit about what we do, especially if you are an aspiring scientist. I think it's really nice to see what a day of a scientist is. But of course, we'll also keep you as a student safety as much as possible, because some of these equipment can be a little bit scary. We have some blades to cut tissues, so we just want to make sure that you are safe as well. So, but we've got a really strong safety committee that ensures that everyone follows procedures. So yeah, go to website, apply on our internship
We're
and
looking forward to
volunteering.
hearing from you, Anon.
Yeah.
Unfortunately, there's no name. All right. Oh, that's a question from Lau Danny. What is your view for the effect of studying science in terms of research?
Um, okay. If this is, I'm trying to figure out if this is if you want to get into research and you're wondering whether you should study science to be able to get into research. What we're seeing with research now is, yes, you have your scientists, and your people who studied science, but more and more research, the whole continuum of research involves people from multiple disciplines. So, whilst science is one way of doing research, I think research is all encompassing. You can have different disciplines, different expertise, and they all bring something to the table quite beneficially, actually. And I think we've seen that in all walks of the research continuum, particularly when it comes to, when you discover something and want to implement it into health systems, that's where we go into bringing in or working with a lot of the people that are, on the ground. They can be things like community workers. They can be people who are experts in understanding health systems, nurses. Yeah, so it's not just science, I guess. I think it can be quite a wide variety.
Mm-hmm. Yep. So hopefully that answers the question.
Yeah.
Okay. And wait, I think I see another one. Again by Anonymous. What qualifications do you require or would be advantageous for your specific job? Ah,
Ah, this is interesting. If I wear my core lab hat, I am still a scientist in training. So as in every skill that I've learned throughout my undergraduate and my PhD kind of builds my skills toolbox, if you would put it. So I would say everything has played a role, particularly in my specific job. Um, Scientists are generally inquisitive. We are very detail oriented. We problem solve probably on a day-to-day basis. I mean, you can do your experiments 5 times and then realize it's not working, and then so you need to
ah,
tweak something and then
yeah,
figure out a better way of doing things and then innovate. So it almost feels probably the qualification is really to do well in any study that you are, be an expert of that, because you can actually essentially use what you've learned in that across different fields and across different jobs, all within the cancer research space. So
yeah.
yeah, every skill you learn and pick up along the way is great.
We actually got the identity of the anonymous speaker. Lim Chiu-wen, yeah, they asked about it, they forgot to untick the anonymous thing. So yeah, so now we know who's the
Thank you.
mysterious anonymous who's asking questions so passionately. Really great that you're having an interest in that. Yeah, perfect. All right. Oh, there's another question from Joelle Timothy Lim. So how did you end up in the
Yeah.
core lab department? Was this something you had your eye on?
Oh, that's interesting. I I didn't take a very linear path. Um, I I just basically pursued subjects after subjects, and I essentially got, for example, I liked biology, did a PhD in stem cells and immunology. And then as I went on, I worked in IVF for a while, and then I worked in clinical trials. And then when I came back to Malaysia, I knew that I am very good at supporting and building systems. And it's almost like a skills match with my mentors at the time to go, hey, we need to build really robust systems, really make sure that every sample is processed the same way. And then I basically saw that and went, okay, I will take this on and I'll make it the best collab that there will ever be. and and so it's not something I really had my eye on, I say, but more of my career trajectory kind of led me to that really maximized a lot of the skills that I knew I could contribute to.
Mhm.
I hope that answers your question, Joel. Yeah.
Yeah,
I mean,
definitely.
as a 19, 20-year old, not many people know what they want to do. So
Oh my goodness.
I
Yeah,
would
don't worry about it. I'm sure they'll find their grounding sooner or later,
every
anyways.
yeah,
Perfect. Okay, I think
yeah.
that's it for all the questions as we are approaching the end of our time. But before that, yeah, finally, Joanna, you can rest and let me take it from here. So now I'm sure you're all interested. Or what about the e-certificate? Okay, so yes, we do provide an e-certificate. And so let me share with you a document right now, a PDF document, just making sure that it is wide because we want to make sure that you can see the screen. All right, here it is. And I'm sharing right now. So you should be able to see this. All right. So, right. Okay, let me just make it clear. Perfect. Okay, so here are the details about the e-certificate for our webinars. And it not just applies to this, but every other webinar that you have, you will attend from Cancer Research Malaysia. So if you're planning to attend the next one by me or my colleague Vishala, then you'll know exactly what to do. So do check your inbox one day after today's webinar. So today is the 16th of July. So make sure to check it tomorrow on the 17th. You should be receiving a follow-up email from us. So from there, you will actually get a feedback form. And once you click the link, they will require you to fill out your details, besides the feedback, you have to give in your details. And also, yes, we only provide the certificate with a minimum donation of RM1. So when you have attached your proof of donation and you fill out your details, really the only details we need from you is your IC name, because after all, we are going to be putting the name right over there. So don't put anything funny right over there because it will reflect in the certificate. And you should be able to receive your e-certificate within 30 days. So but if you have any inquiries or if you still have not received your certificate within 30 days, you can reach out to us via the email right over there. So it's de-comms@cancerresearch.my. So this is how you can reach out, where you can reach out to us regarding anything, any questions for the e-certificate, and we will get back to you as soon as possible. So hopefully that is clear. I've tried to make it as straightforward and easy as much as possible for you to understand. So yes, so I think that is actually the end of our webinar. Once again, thank you all so much for taking the time and listening to Joanna and I have a chat. It's been wonderful. So again, thank you, Joanna. This webinar wouldn't be possible without you agreeing to do this. And I hope that your experiences, as well as talking a bit more about what goes behind the scenes in the lab, can actually influence people to you know, maybe one day become scientists themselves, they pick up the same path as you, and also to enlighten them on what the whole thing is about. It's just one small part of research, but it's still something to work on.
No worries. Thank you so much for having me, and thanks everyone for taking
Thank
your
you, and goodbye.
quizzes.
I hope to see you all again in the next webinar. Thank you.
Thank you.
Thank you.